the co-responders, the mental health coaches, mental health officers, and so on. So then looking at long-term solutions, we really believe that we have to have a sustainable service model. So developing a plan that will incorporate innovative and sustainable strategies through upstream service delivery approach. So rather than being reactive and having to send somebody on the worst day of their life in a squad car, handcuffed across the state, can we divert that all, if at all possible? So looking at public and private partnerships to be able to do that right here in our community, better for everybody involved, law enforcement, human services, the person who is experiencing that acute episode, and, I mean, just in general, and it would be a win-win-win all the way around. So we are always looking for grant opportunities. We've engaged regional planning to look at some grant opportunities for us, expanding local facilities capacity for crisis beds. So rather than building from the ground up, is there a further expansion that we can do at an existing facility? But when we talk to our private partners in hospital settings, the one thing that they told us is that the sustainability is really the key. So it's mental health services are expensive, and taking on an adventure like this would be without proper reimbursement would drive them out of business. They just couldn't sustain it. So looking at what is the reimbursement from the state and how can the state maybe reconcile with private organizations to make sure that they are staying whole. So with all of that, we invited our legislators back to Polk County. So they came to our house on January 3rd, so we could do this wrap-up meeting. Same thing I'm telling you guys tonight. So we had a really good showing on that Friday. We wanted to catch them before they went into session. So we did, right before they went into session on January 6th. Oh, yeah, sorry, we're behind
That one.
Okay, so this is just a picture of who was at the meeting. So we had 6 legislators or their representatives attend this meeting, which is remarkable. I think that there's interest. They like what they're seeing, what the Western region is doing. So we had really good conversation, and the takeaways from that meeting, this is kind of micro print, I guess. There were a lot of takeaways. So looking at those prevention diversion efforts, knowing and acknowledging there will always be a need for involuntary inpatient beds. It's just, some people are just going to have that level of care. But if we can divert when we can, we want to do that. There's a shared concern over sustainability given the current funding and reimbursement models. One of the legislators talked about looking at the payer mix and what Medicaid is reimbursing and how Medicaid is reimbursing, because that's one of our most significant reimbursements pools of money. And we can tell you that the reimbursement isn't great. And then looking at what exactly does fully funding crisis and CSP mean? Those are very big programs with very big costs. So my personal interest, and I think the counties too, is like, what does that mean if the state's going to fully fund it? It could be a good chunk of relief on our local dollars that are required to meet this need. Everybody said this is a nonpartisan issue, and it takes everybody working together to solve. There's also, some of the legislators shared that there's work on the legislative level on third-party transports and clinicians being able to initiate an emergency detention. So right now, law enforcement is the one who has to determine. We've got some supports that go in to help them determine it, but it's ultimately law enforcement's call of the emergency detention, Chapter 51 it's called. There is concern strain on resources for crisis services for all ages, and the high acuity youth. We've gotten in front of Health and Human Services Committee earlier this year on some of our youth who are needing to be placed out of state. in those really expensive placements because that's the only place we can find for them. And when we search across the state, we're searching all states in the nation. They're few and far between. So I was glad to hear that there is acknowledgement that that's an issue as well. There's a smart form that has been developed to try to help ease the amount of wait time that law enforcement has to get somebody cleared to go over to Winnebago. They can sit in an ER waiting for up to 8 hours to get some testing done. And it's a waste of time. So this smart form is being used. And I do believe Chief Deputy Burrows is working with Winnebago right now to see if they will accept that from our local law enforcement. So hopefully fingers crossed on that one. So the counties are always encouraged to come to Madison, meet with legislators whenever. There's a Human Services Day at the Capitol coming up. Anybody here is invited to attend. We will load a car and go down. But like Supervisor Olson said, get on the phone and call these legislators anytime. They want to hear from us. There's more data needed from the counties to drill down on issues to create those solutions. So getting our work group together to find out like what is the most simple way we can break this down for our legislators so they can go in with their one-pagers and advocate for us at the state level. And then always looking for those grants. The one thing that we did here was that they want us all doing the same thing across the state. And the way the model is set up right now is that counties are kind of on their own to figure things out. So they would like to see a unified model, which I would agree with, as long as it's done right. And that's about all. So
Do a lot of people go often, or is it
frequent.
frequent?
No, we've answered that question, and actually it's not as frequent as one would think. If they are, that means that we have not connected them to the resources they need in the community when they come back and get that emergency detention dismissed. So they might go once or twice, but we're connecting with them and making sure that they're getting those services. Do you want to call in? Do you want to call on these guys, or should I just?
Go ahead.
Did St. Croix Hospital have any interest?
I
mean,
think-
they're gonna build new, they bought land.
Right. I think they definitely want to talk to us, but that sustainability piece was the biggest concern. They need that addressed before they would look at expanding and developing something for us. But they wanted to hear what we had to say.
How many people do you usually go through a year or a month or what?
I figured that question would come up, so I got my stats right here. So this is overall. For emergency detentions, I can go back solidly to 2021, 53 detentions, and that could be at any of the facilities. 37 were dismissed. 2022, we had 42 and 26 dismissed. In 2020, where's my 23? 50 total, 31 dismissed. 24, we had 43 with 19 dismissed. And so far this year, we've had 5 dismissals.
So even if, just one more.
Yep.
If it's dismissed, they still pay the 2,100 a day to bring them over there.
First 3
then they
days,
come back.
we're on the hook. Yep, and it doesn't matter if
So
they're
that's
an out,
6,300 just for that. That's not transportation.
correct.
Okay.
Yep, so the first 3 days is mandated. And wherever the crisis happens is the county is responsible. So usually when we find out if it's an out of county person, we work with that other county to get transferred or, back to their home county so they can get their services there. But the first 3 days are our responsibility if it happens here. And those rates just went up in October to 2,100.
What's the
So in 2023, it was 1627. 2024, it was 1790, and it just jumped up to 2,100. Most of that we end up paying for because of how insurance companies won't pay for that service. Every now and then we get them, they will pay. But our population is a pretty big Medicaid base, and Medicaid will only pay if the person is under 21 or over 65. So if we look at our demographics, most of our people are in the bubble. There's supposed to be work at the legislative level on that too, and
This is without transportation.
this
You
is
still
without
have to go
transport,
back
that's,
and forth.
yeah.
What's that average at
Did we figure it was like 12 to 1,500 per trip?
per trip?
So
You
they,
have to have two people.
depends,
Oh,
it
okay.
depends. Do they always do two? Do you know? I'm not sure about that.
I thought sometime with email or something, they have to be safe.
I suppose, yeah. So they have to go to the facility and then they have to come back for court.
Back
So
3
we're
days.
doing back and forth. During COVID, we were able to do some more virtual. But if they're being dismissed, they need to come back here anyway, so they're coming and getting them and just the dismissal and then they go back home or in a facility or wherever we need to put them.
No,
10,000 almost for one person.
it's not always the sheriff that's doing the transporting. So if a local municipality is doing the transporting, then
Mhm.
they are the ones that bear that cost.
The transportation.
Right, and so.
Do they bear the in-house there, the 2,100?
We are always responsible for the,
Always
it's
responsible.
the county.
The county's
But
always
the
responsible.
municipality would pay for the transport, the officer to get them.
So one of the factors too, and one of the complaints from one of the local municipalities is we only have one officer. And so if we have an incident like this, that officer now has to bring the person to a local hospital to be cleared. Clearance can take multiple hours, medical clearance, and then they have to drive to Winnebago, which is 5 hours. And then they have to drive 5 hours back. So that municipality has no officer if they can't get another person to come in for upwards of 12 or more hours. So it's a problem.
So what if they aren't dismissed after 3 days?
Then the department needs to figure out where they're going. If they can be discharged to home with some supervision and intensive services, do they need a lesser restrictive adult family home? Sometimes they go back to Winnebago if we can't. We try to avoid that at all cost, for all cost reasons. But we try to get them hooked up based on their level of need. So it could mean that we're paying for an adult family home or CBRF or something like that.
So when, like, in 2021, there were 53 total and 37 were dismissed. So the dismissed means they were let out of Winnebago after 3 days, right?
They came back here, had their hearing.
Yeah.
It was dismissed.
Dismissed.
No, we don't have to have mandated supervision, but we are still getting them hooked up with services because they just had experienced a very traumatic, significant
Yeah.
crisis event.
So what happens with the other 16 that weren't dismissed?
So they would be on our supervision for 6 months and then
They come back here after 3 days?
most likely, so that's where I said that we would look at either in-home services or adult family home or something to meet their needs so that they can be successful
Yeah.
while they're on that supervision with the goal to be rehabilitative. So they don't need that in 6 months. Every now and then we have to extend the commitment to another 6-month period. I don't know what the data is on that, how often we're extending them.
Infrequently.
Yeah.
Most people are returned to a situation where they don't need ongoing supervision from the county beyond the 6 months, most.
Yeah. So I think that's a good kudos to our behavioral health team for connecting with people and working with them to get them off of supervision.
Not really a question, more of a comment. I think we should really appreciate what staff has done here. I mean, they've turned this around in pretty fast time. As far as what they've done and reached out to other counties and legislators and to have 6 legislators sitting in upstairs on the 3rd was pretty impressive. And they really are looking to do something. I guess we'll see what they get done. I think it's up to them now to figure out the legislation that they believe that can get passed. But staff has done a very good job over the last 5-6 months of getting this pulled together and doing the work that needed to be done. And then one more thing, Tanya, that we hit on the other day, and I can't remember the name of the place of it, but how much do we spend on the phone number to call in? I mean, we look at this and think it's expensive, but the 170,000 or whatever it was,
Yep.
that's a yearly bill to HHS for a phone call. So if you could expand on that just a little bit.
So we are DHS 34 certified. That's crisis services. That means we provide 24/7 coverage for crisis needs in the community. We don't provide 24/7 in-house. We have a person Monday through Friday for walk-ins, but otherwise we use Northwest Connections to do our mobile. So if somebody calls in and they have to go out on a call, the Northwest Connections folks are going out there. We pay for that service. That's the 170,000 that we're paying per year. Goes up every year.
Just a comment, to add on to Brad, just thanking Tanya for her lead on this and this ad hoc committee, which developed into another smaller ad hoc committee, working with the other counties, to sit in the room with the legislators. They weren't just sitting there listening to us. They were actually engaged in conversation with each other and coming up with ideas and concerns and paths to go down this. So a lot of support and very successful meeting.
Yeah, I wish we would have recorded it. It was great. I've never seen that level of engagement. And you were there too. So yeah, it was a good
And
experience.
Tanya was the mediator for that one and kept it going and kept it on topic and kept circling back to the issues and what they actually needed
We,
from us to move
and
forward.
we ended with, what are you going to do for us when you show up January 6th in office? So we put it back on them too. Not that it's all on us to figure out, so. And I think they accepted the challenge.
Anybody else?
Do you want me to stay for the next, or you got this one? I will remind you though, this board did send through the crisis and CSP funding to the state. So it was a supportive resolution. We did that a few months ago. So thank you for that. That will be helpful.
What you're asking is if you want to stay for the presentation of the resolution that is connected with your presentation.
Do you want me to stay up here and answer any?
You might as well. There may be.
We'll tag team then.
Yeah.
We need a motion on it first, on resolution 0123. A motion to bring it to the floor, resolution 0125 for discussion.
Second.
Yeah, 23 isn't available, is it? Any discussion on the presentation of the resolution? Okay, all in favor? Aye.
Aye.
Those same sign. Okay,
That was easy. Thank you.
That was just
all right,
discussion.
Oh,
Right.
oh.
To approve the resolution, to support it.
it was open for discussion, was it
Right.
not? Yeah, need a motion to approve it.
I move to approve support from the board for resolution 0125.
I'll second it.
Any discussion on that? All in favor? Over same sign. Thank you, Ted.
Okay. I'm good. Done. Thank you.
Okay, I have no appointments. So we'll move on to the administrator's appointments, if any.
I have no appointments.
Okay. I have, you basically have heard the report. And we also have a discussion on our February meeting, so I'm gonna hold off any comment on that. So, Administrator, what do you have for us?
Just a couple things, Mr. Chair. Start out, Happy New Year, everyone. First meeting here. Just a couple things. The Clam Falls Dam project is on schedule when their actuators come in to be completed by summer. The recycling project is actually winding up now. Inside work should be completed by the end of February with the paving and landscaping done in the spring. In the budget process, we put aside 50,000 to look at converting part of the ADRC building into a kitchen for Meals on Wheels to look at that. We did get bids in and cost estimates from an engineering service, which came in quite high at around 900,000, 850, 900,000. So we are now looking at more options and to bring that number down with that. So we are still looking at that.
They just built that new facility. That wasn't that much.
It came in around little above 600,000,
Yeah,
but it was a smaller kitchen than what we need down here.
okay.
But we are looking at options on a bunch of different avenues to bring that number down. 2024 closed with 8 fatalities on our roadways. That's down from 16 in 2023. Our average for Polk County is 11 per year on that, so which is high for our county, but so we have. I'll be going down to Madison for the legislative conference in February 25th and 26th. Bring back information and maybe some updates on what's going on with the mental health. The county board meeting, as a note, in March will start at 5:45. That'll be for a public hearing on the library plan, that 5-year library plan. And then at HHS, there was a presentation. There's an American Legion event here in Balsam Lake on March 8th and 9th. It's a Freeze for a Reason. It's to bring attention to homeless veterans and suicide. So you'll probably see flyers being posted around for that. And that's all I have right now.
Okay, thank you.
Can-
Now we have a supervisor. Oh, I'm sorry, Brad, what do you need?
Can I ask a question about the recycling resolution? Recycling resolution, I mean, can I ask a question about that?
Everybody's looking at Joe.
You squint at me, Joe, I can't see if that's a yes or a no.
It was in the update, Joe.
Yes, I think a follow-up question can be okay as long as you don't get too deep into anything.
All right, you holler at me when I get
All
too
right.
deep, okay?
I will.
So I've never had so many calls on something the county board has done before, but I guess here's probably my main question. In the first now therefore it be resolved clause, it says that it will be applied to all landowners with improved property. And yet there seems to be a wide variation of what improved property is in groups that have been exempted. So I guess my question is who made that call? Of who's exempted, who's not exempted, and some that are exempted are still getting fees for the same things that others are exempted for.
The resolution went through the Public Works, Public Safety. At that meeting, staff explained that we were looking at only properties with residential, commercial manufacturing and exempting ag and a category called other out of it. So it was just those 3 categories.
So why do I have people calling me saying they're getting billed on ag?
If their assessor, get this right, ag, if they're 4, 5, and 6, and 7, 4, 5, and 6 are ag, 7 is other. If you have a farm that has the homestead or the house that's separated out from it, and your assessor has assessed that as 1 residential, they would get the fee. If the assessor had put that in improvements under category 7, it would not get the fee.
Okay. So let's say someone has a billboard on the side of the road. Why is he getting charged for some billboards, but not other billboards? And the fact that the fee more than doubles his taxes on it.
on a billboard. It would determine.
So I don't want to get
It was
too
assessed.
far beyond
Okay, all right,
what was reported in the administrator's report.
okay, I'm fine with it.
Okay, easy. Okay,
If you could send me examples.
do we have any announcements from supervisors and reports from any particular meeting or something they'd like to share with us? Seeing none? We'll move on to our February. There's been a lot of discussion about the February meeting and potentially eliminating February. We've talked to just about everybody. And the committees really have not offered much of anything that would require county board attention. So I believe that probably will cancel the February meeting unless anybody else has anything to talk about or discuss in reference to canceling the February meeting of the county board. Does anybody have anything? Do we have any opinions? You have anything to add to that, Mo?
No, right now, there's nothing coming from a committee that needs board approval or looking at the meetings coming up in February for Public Works, HHS, and the need for those, or general government. There's no pressing business in February. The exception of the ES committee meeting, which doesn't need any board approval in February.
Ivana, do you have anything that you,
No, just if we do change it and do need a February meeting, it would have to be on a different day as there's a spring primary. Historically, we've moved it to that Thursday instead of Tuesday, so just something to keep in mind if we do need.
if we cancel the meeting, you'll handle all of that?
Oh, of course.
Of course. Okay, well, I expect we'll probably cancel a meeting. You'll get a note accordingly. Russ,
Motion to adjourn.
Second.
is all in favor? I didn't.
All right.
You're right. Oh, well. Yeah. Same thing, so you can't.
Yep.
First time, so.